Welcome back to Ophthalmology for undergraduates and postgraduate beginners. People have watering from their eyes. Watering is of two types. One is hyperlacrimation. Another thing is called as epiphora. What is this hyperlacrimation? Hyperlacrimation is increased secretion of tear fluid by the lacrimal glands. It may be due to many reasons. Epiphora is a different term where the outflow pathway of the tear fluid is affected, leading to pouring out of water from the eyes. So that is called as epiphora. Here the fault is with the lacrimal drainage system. Today we are going to discuss about a short case that is called as Dacryocystitis. A 60-year-old male patient came to my OPD. He presented with the following complaints. He said he was having watering in the right eye for the past 2 years and on and off mucopurulent discharge from the right eye also. Apart from that, he told that he is having a swelling in the right eye. All these things are present for the past 2 years. He said this problem had an insidious onset and it is gradually increasing over the period of 2 years. Initially, the swelling was very small. Now, the swelling has become a little bit bigger. This was his complaint. When I further inquired into the case, the patient said, I am not having any pain. I am not having any other problem in my eyes. I don't have defective vision. So, patient did not have any other problems in his eyes apart from these symptoms. He is our patient who is having a swelling in the right eye. This is almost a hemispherical swelling situated medial to the medial canthus and just below it. The swelling is about 2 centimeters in diameter. You can see water logging in his right eye. Apart from that, there are no signs of inflammation. The patient does not have any pain or tenderness there. The swelling is not warm and the swelling is not red in color. So, there is only a swelling and there is water logging in his eyes. This patient can press on his own swelling and cause regurgitation of fluid through the punctum. So he is able to do it very easily because he does not have any pain. This is called as Roplast test, regurgitation of fluid on pressure over the lacrimal sac. You can see the fluid coming out and pouring out of the lower lid. You can see after the Roplast test, the swelling has reduced in size. From the findings of this patient, we have come to a conclusion. The diagnosis is chronic dacryocystitis of the right eye. What is chronic dacryocystitis? A chronic inflammatory swelling of the nasolacrimal sac, which is beyond a period of 12 weeks or 3 months, is called as chronic dacryocystitis. Now, how to proceed with this patient? We can do a simple Roplast test. Already we have seen in this video, when the patient presses on the swelling, the fluid is coming out of the eyes and the swelling reduces in size. Patient has already demonstrated it on its own. If you want, you can also do it. by giving pressure over the sac and looking for regurgitation of fluid through the punctum. That is called as Roplast test. In this case, the Roplast test is positive. Regurgitation on pressure over the lacrimal sac is positive. The next test you want to do is duct patency testing. You can take normal saline in a syringe using a lacrimal cannula. You can inject this normal saline into the nasolacrimal punctum. And if you do like that, what will happen is this fluid will either go into the patient's nasopharynx or it may regurgitate through the same punctum or it may regurgitate through the opposite punctum. If it goes into the nasopharynx and the patient swallows the fluid, then the lacrimal drainage system is intact. If the fluid regurgitates through the same punctum, it says that the canaliculus where you are injecting this fluid is obstructed. If the fluid regurgitates to the opposite punctum, suppose you are injecting to the lower punctum, the fluid is coming through the opposite punctum, that is the upper punctum, then there is an obstruction in the nasolacrimal duct, that is draining the sac into the nasal cavity. This way we find out where there is a block in the nasolacrimal drainage pathway. Next test we can do is dacryocystography. What is this dacryocystitis? Dacryocystitis is injecting a dye into the punctum and taking an X-ray of the nasolacrimal drainage system. It will show where there is an obstruction, where there is collection of fluid. The next thing is the dacryocystigraphy. We inject radioisotope substance, that is technetium-99, into the punctum, and with the gamma camera we track the flow of this substance and find out where there is an obstruction in the nasolacrimal drainage system. Next thing is what we should do is a nasal endoscopy. We should get the help of the ENT surgeon, do a nasal endoscopy and look for any obstruction in the drainage of the nasolacrimal duct into the nose. As all of us know, the nasolacrimal duct drains into the inferior meatus. The inferior turbinate may become hypertrophied and obstruct this opening, or there may be a nasal polyp in the nose which may obstruct this opening, or there may be a deviated nasal septum which is obstructing this opening, leading to decreased drainage of fluid or obstruction of drainage of fluid from the lacrimal drainage system into the nose, leading to collection of fluid in the nasolacrimal sac, leading to all these problems. Another important test in the diagnosis of Dacryocystitis is probing test. What is this probing test? We have a probe which can be inserted through the lacrimal punctum. It travels through the vertical canaliculus, it travels through the horizontal canaliculus, it travels through the common canaliculus, it goes up to the nasolacrimal sac. It can also travel through the nasolacrimal duct. So this is called as probing. This probing is done to find out whether there is an obstruction in the nasolacrimal duct or if it is present only in the canaliculus. If it is present in the canaliculus, the probe will not pass for a long distance it will stop short of it and it will be hitting against a soft tissue or obstruction. So that is called as soft stop. If there is no obstruction in the canaliculus, this probe will go into the nasolacrimal sac and it will hit against the fossa on which the sac is situated, that is the nasal bone. So this probe will hit against the nasal bone, that is called as hard stop. This way we can find out whether there is an obstruction in the canaliculus or in the pathway below that. Another simple test we can do for this dacryocystitis is Jones test. It is having two parts, Jones test 1 and Jones test 2. You put 2% fluorescein drops into the conjunctiva and you give a wisp of cotton to the patient to be kept in the nostril on the side where you put the drops. Usually it may take around 5 minutes for the fluorescein to pass through this drainage system and come through the inferior meatus. So when it comes there, it will stain the cotton wisp we have kept in the nostrils green in color. So that is Jones test 1. If it does not get stained even after 5 minutes, the next thing is Jones test 2. What we do is, we syringe normal saline into the punctum and we look for the staining of the cotton. If there is a physiological non-functioning of the nasolacrimal drainage system, or if there is a partial obstruction, then while syringing, the dye, that is a fluorescent dye, will go down and stain this cotton wisp. So that is the part 2 test. By this way, we find out whether the nasolacrimal drainage system is patent or not. Another simple test we can try is dye disappearance test. What is that? You put 2% fluorescein into the conjunctival sac, one or two drops there, and you just see the eyes after 2 minutes. After 2 minutes, what will happen is, because of the continuous secretion of the tear fluid, this dye gets diluted and it gets washed away into the nasolacrimal drainage system if the drainage system is patent. If it is not patent, the dye will remain in the conjunctival sac itself, or it may dribble down on the cheeks. So that is called as dye disappearance test. So we have so many tests. Okay, we can try all these tests, but our diagnosis is confirmed with the simple test that is called as the Roplast test. If you want, you can do a duct patency testing and go for a nasal endoscopy. All these tests may not be needed. If it is a pediatric patient, then we can go in for a dye disappearance test, or we can go in for a probing test. So this is how we investigate. You should know all these tests are available, and if the examiner asks, you should be able to answer him. The treatment options available for our patient is, one is dacryocystorhinostomy. Another thing is dacryocystectomy. So this is the option we are having. This dacryocystitis can be surgically done, or it can be done with the laser. Two ways it can be done. As all of us know, there is an obstruction in the nasolacrimal duct Because of that only the fluid is getting collected here. When the fluid gets collected here, infections grow here, leading to inflammation and causing dacryocystitis. Acute dacryocystitis will have all the signs of inflammation that is exaggerated. You will have severe pain, the swelling will be very big and there will be surrounding cellulitis. It will be warm, it will be red in appearance and the function is also lost. In chronic dacryocystitis like that of ours, the swelling is alone there, but there is no redness, there is no pain, but there is loss of function. It is not warm. So, that way our case is presenting. Now, how to manage this patient? We don't want this to continue forever because someday it will become severely infected, leading to acute dacryocystitis, cellulitis, and it may affect the eyes. With chronic conjunctivitis, all those things may happen. So we don't want such things to happen. So we want to treat this. How to treat this? The best treatment available is the dacryocystitis. What we do here is, we make a cut over the sac in the skin area, cut the medial ligament, that is a medial canthal ligament, and we dissect this sac. We separate this sac which is sitting on the bone, nasal bone there, and we break this bone. We open this sac, we open the nasal mucosa and we suture them so that the water that is going through this part, without going through this, it bypasses into the middle meatus of the nose. So this is called as dacryocystitis. This can be done in a different way also without making a cut on the skin, by doing a endonasal laser procedure. Using a endonasal laser procedure, we fill this sac with the dye. And we take the laser here with the endoscope. This endoscope will detect where this dye is collected. Exactly in that portion, the laser is applied to make an opening in the nasal mucosa, opening in the bone, and also the medial wall of the nasolacrimal sac, so that a pathway is created for the fluid to go into the middle meatus of the nose. This is a very, very simple procedure. Patient can go back home immediately and there will not be any scars on the face. So that is called as dacryocystitis. Suppose due to severe destruction of the sac because of the chronic inflammation, or there may be some problem in the nose causing atrophic rhinitis, the mucosa of the nose is atrophied or the bones are affected due to some diseases, then we may not be able to do this dacryocystitis. There we should remove this sac. Now you will ask me, once you remove the sac, where will the tear fluids go? Tear fluids has to just pour out. Patient has to wipe it whenever the tears dribble down the face. So dacryocystitis is the best procedure as far as the patient is concerned. If laser procedure is possible, definitely we should do that. We have one more treatment for this dacryocystitis if it is a congenital one, that is probing. Already we have told that what is this probing. Here it is done for congenital dacryocystitis because of the non-functioning of the nasolacrimal duct in children, or there may be a congenital non-development and there may be a small obstruction in the nasolacrimal duct because of its not opening following birth. Now you can send this probe through the punctum, through the canalicus into the sac, and we can pass this probe through this nasolacrimal duct so that whatever stricture or closure is there, it will get opened so that it will start functioning normally. This is usually done for pediatric patients. With this, I will stop here. Dacryocystitis is a very common case kept in the examination. You should watch this video fully so that you will be able to answer all the questions to the examiners. Thank you. We will see with some other short case in the next video.